Hair loss is an issue that many people face, regardless of age and gender. The essence of the problem is that the reasons behind it can be diverse, and each case of hair loss has a specific underlying cause. There are several diagnoses related to this issue. First, diffuse telogen effluvium, which can arise from various factors and requires an individual approach to treatment. Second, androgenetic alopecia, associated with hormonal changes. Finally, alopecia areata, characterized by hair loss in specific areas. Solving the hair loss problem is not as straightforward as it might seem at first glance. A universal treatment guide does not exist due to the massive volume of information, much of which may be irrelevant to a particular individual. It's important to understand that without professional diagnosis, it's difficult to determine the type of alopecia and choose the appropriate treatment. Therefore, it is necessary to consult a specialist, such as a trichologist, who will conduct the necessary examinations and prescribe treatment. Self-treatment in the case of hair loss can be not only ineffective but also harmful. Video guides and advice found on the internet may not achieve the desired result and can even exacerbate the situation. It's crucial to understand the difference between regular hair loss and alopecia. Hair loss is a natural renewal process, while alopecia is a condition in which new hair does not grow in place of the fallen ones. In some cases, hair loss is temporary and does not require special treatment, for example, during seasonal hair renewal. However, if hair loss continues for more than 3 months, it is advisable to seek medical help. It's important to realize that true hair loss treatment requires a comprehensive approach and often involves both medication and lifestyle changes. This material remains relevant, even in the context of noticeable hair density reduction, when obvious hair loss may not be observed. Such a phenomenon can be considered a psychological paradox. Intense hair shedding does not always indicate imminent baldness. In some cases, when a significant decrease in hair volume is noticed over a short period, it is important to correctly interpret the situation for psychological comfort. From a psychological standpoint, it is the loss of hair, not baldness itself, that is hardest to bear. The feeling of heaviness intensifies when hair is found on surfaces where it should not be, especially when hair loss occurs suddenly and in large quantities. It can be seen as a good prognostic sign, unlike gradual balding that happens unnoticed by others over many years. Such a condition may seem unexpected, but in some cases, specialists find it easier to deal with sudden hair loss than with a slow process that lasts for years. In situations where hair does not recover even with medication support after a period of intense shedding, there are treatment approaches for each specific case. In certain conditions, such as androgen-dependent alopecia in both men and women, the key aspect is not so much the frequency of shedding but rather the thinning of the hair and a reduction in its overall volume. Attention often focuses on the widening of the parting and the recession of the hairline. In these instances, under the influence of androgenic hormones and increased follicle sensitivity to androgens, hair becomes thinner and shorter with each new growth cycle. Due to certain circumstances, the lifespan of the hair can decrease, leading to increased shedding. This phenomenon, observed in the majority of cases of androgenetic alopecia, hides its danger in being able to continue for years, remaining unnoticed until the loss of hair volume reaches approximately 30%. This is especially noticeable in the crown area, where hair begins to thin. Statistics show that if more than 5 years have passed since the onset of the problem, the effectiveness of therapy significantly decreases due to the neglected condition of the follicles. However, alongside hair transplant methods and the use of minoxidil, there are numerous external and systemic remedies that help at least maintain the current hair volume. There are several forms of alopecia, including focal, where hair falls out in patches, and total, covering the entire head. Moreover, there are cases when not only the hair on the head is lost but also eyebrows, eyelashes, and even hair all over the body. This phenomenon is known as universal alopecia. It's important to understand that these forms only reflect the degree of hair loss and are not indicators of the process's dynamics. It's worth mentioning separately that in some cases, for example, under radiation exposure, hair loss can occur very quickly. In other situations, such as with certain immune disorders, hair may begin to fall out because the immune system mistakenly perceives hair follicles as foreign bodies. Despite the seemingly hopeless situation, many studies confirm that after the first episode of hair loss, 75% of cases observe a complete restoration of hair volume within 5 years without any intervention. There are therapeutic methods that do not always bring a 100% result, but still can contribute to an improvement. However, the difficulty in assessing their effectiveness lies in the fact that it is often unclear what exactly leads to the improvement, due to the therapy applied or natural recovery. Currently, various treatment approaches for unpleasant health conditions are widely discussed, including comprehensive descriptions in specialized video materials. Among the common health issues is the undesirable and sudden increase in hair loss, often associated with diffuse telogen effluvium, a condition where hair loss occurs evenly across the scalp. This can be the result of stress or other significant physiological changes, for instance, following anesthesia, serious infections, significant blood loss, or childbirth. Such phenomena can be particularly noticeable in individuals with certain predispositions. Acute diffuse hair loss usually resolves on its own. Focusing on restoring overall health is crucial. Hair volume recovery occurs without external intervention if the body returns to normal. However, some specialists may take advantage of this situation, offering expensive procedures such as plasma lifting, mesotherapy, or ozone therapy, even when they are not necessary. It is essential to understand that the process of stopping hair loss naturally is related to the normalization of health status, not the effect of any cosmetic or therapeutic procedures. During recovery, it is recommended to focus on maintaining health and avoiding unnecessary interventions. If a patient finds that some methods do not bring the expected effect, it might be worth revisiting expectations and trusting the recovery process, rather than making hasty conclusions about the causes of the problem. In cases where the condition presents itself as persistent or diffuse, it is crucial to conduct a thorough investigation, including a series of tests capable of identifying the underlying causes of such a state. Additionally, there is a specific external treatment that targets key areas and contributes to the stimulation of hair growth. It is essential to emphasize that the first step should be to consult a qualified specialist to obtain an accurate diagnosis and appropriate recommendations.